All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. And right away, I'm going to answer from Arun. Arun had a question that does the Epstein-Barr virus is plasmid not go in the nucleus? It does go in the nucleus. So in my illustrations, I think I'd made it outside. It is in the nucleus. It sits in there as a plasmid, and it is just with the other nuclear activation, it is activated in there as well. So that was a good question. So Arun, the study that I saw, I think more than 50% of the long COVID in there had the EBV activation. So Joy says, I'm catching on to finding part 2. So Joy, part 2 tomorrow, and then the study on Monday. James Crooks, how are you? Jim is here as well. Jim, how are you? D. Diaz is here. D. Diaz, how are you doing? Drbeen is here. Hello. Texas is here. Hello. Claire is here. And let me show you Claire. From Claire, I remembered Carol Ann. So here is Raj. So Raj is a Bengal as well. And he is Carol Ann's Bengal, or Carol Ann is his human. He actually looks very much like Luffy. So Carol said that he is sleeping after my melatonin lecture. So melatonin lecture knocked him out. He looks like a little devil. That is how Luffy looks. He also has these kind of ears, Luffy, and this little more pointy snout. Kyrie has a rather stubby snout, but Luffy also has this little longer snout. So cute devil here. Okay, so hello everyone. Let's have another question. Colombian Coffee Bean says, thank you for the talk. You're very welcome. Dr. Bean, when do you think vaccines will get the FDA approval? So now there are companies that are trying to get the approval. I think the problem will be that they are fighting, probably trying to influence internally all of them to see who gets the approval first. So first, these companies have done a lots of selfish things with humans. I think now they're going to do selfish things with each other to see who wins. Okay, so Joy Fisher says part 2 equals random question. I see. I thought you're talking about the part 2 of the Epstein-Barr virus. Raj is very cute, yes. Presh says, I was just diagnosed with breast cancer and I'm wondering, is my immune system compromised already as far as COVID high risk is concerned, or does this only happen during treatment? So in case of, depends which kind of breast cancer is this, but your immune system is working fine. The immune system is suppressed while doing the treatment, and at that time COVID vaccine or actual COVID may not be able to generate enough response. But generally during a cancer, if the chemotherapy is not going on, and if the cancer type is not such that that is destroying the immune system itself, then immune system is functioning. I hope that you recover fine and fully and soon. So Stephen, this is $1 million question. What is the protective antibody amount? And I did a study, discussed a study a few days ago where the authors were trying to figure out what is the right amount for the protective antibodies. And their own challenge was various kits have various thresholds on them, and various people had various convalescent plasma titer levels. So it really is not clear what is the right amount of antibody. Still, if you take any of the test, in the test, there is a threshold to say below this threshold means that system is not reactive. Above this threshold means there are B cells that are making antibodies, and they will make antibodies more when the actual infection occurs, because they would increase in in numbers, and they would produce more antibodies in a healthy person. So because of this saying, I'm sure that at some point this number will come around, and we'll say, hey, a number of, let's say, 200 is international units is sufficient for across the board. But today we don't have that. Neri L says, how can I test my T cells if I live outside of contiguous US? T detect is only available in continental. So that's a problem, because ideally what you're looking to do is, or as this test does, what it does is that they take patients' blood. In the blood, they have antigens, let's say from COVID, and then, or they take standard COVID antigens and take patient's blood and take T cells from the patient's blood and expose them to the standard COVID antigens to see if T cells become active. So can this be done by other researchers? Yes, there are so many researchers all over the world that do these kind of tests, but I do not know if they're commercially available outside of the US. And he can, I just, France, handsome kitty, yes. I heard this. Charles says, and he can curse when needed. Who are we talking about? Me? I will be totally fine. Or is it Raj or someone else? So Michelle says that acyclovir side effects cause alteration in DNA. Ideally not. But let me back up and provide a possible. If an antiviral offers a genetic material building block that is fake raw material, and then our cells are dividing, and that raw material accidentally gets picked up by them, then that can cause damage to us, our cells as well. But usually that is a point of using testing these drugs, to make sure that the quantity of the drug and the type of raw material change is such that it would have least effect on us. Moose Lodge says, stay strong, Dr. Bean. You want to be on the right side of the history. So Moose Lodge, thank you very much. What is interesting for me is if you go to Twitter, there are people who are propagating that vaccines are bad, and they say we are on the right side of the history. And then there are people who are saying vaccines are good, for example, and they're saying we are on the right side of the history. There are people who say ivermectin, I'm kind of that. Ivermectin is a great thing, and they're saying we are on the right side of the history. And then there are people who are censoring ivermectin and kicking it out, and they are saying we are on the right side of the history. Nobody is saying I am on the wrong side of the history. So I think what is happening is folks have their own groups, and whatever is their group's belief is the right side of the history for them. For me, it is just very simple. I present knowledge that is coming out in studies. I present medical concepts, and that is what we have. Now, based on that, people can make their decisions. And this is more of a book. This book sitting over here, these books don't have a leaning towards Democrat or Republican or this religion or that religion or this group or that group. I'm hoping to do that. I'm a human being, so I have my biases, I have my inclinations, but that is how I want to be. So, Deef and we, I had actually thought by now from the US, COVID would have gone. So we are still stuck with it. I think in many countries it is about to go away, UK or Israel and India. I hope India does never have another wave. They have a large population. I think the way COVID is going to be is just some nuisance, another human coronavirus after some time, after causing all this damage, after hurting us. Eventually it will have to adapt, or it will have to be eliminated. Luckily, our immune system against this stays on protecting for years, which is a good time for COVID to eventually go away. You truly are doing that, Dr. Bean. Highly partial and objective. Thank you very much. I try. So Anonymous says, what do you think the reason why people get long COVID after months of recovery? I heard there's a lot of reasons, you can name all. So I'm sure that I have some studies that I've not read. For example, the study that David sent that started this series of talks, I had not seen it before. So that means there may be more studies that are out there that I have not seen. So that means, can I name them all? I cannot. What I know so far is the following. Long COVID can be because of the macrophages that have become mad enough and they are not settling down. And so they're continuously producing the cytokines that are keeping the immune system active. That's one possibility. Other one is mast cell activation syndrome. And we know that mast cell can be cyclically activated because they are kind of moody cell and they need triggers, and those triggers can cause them to become active. And when will they respond to a trigger is up to them. Then we have monocyte carrying S1 protein, Dr. Bruce Patterson, Dr. Yo, that team's research. If that is the case, then there will be a continuity, and that continuity may be interrupted by a person's behavior of, let's say, less inflammatory medicine or nutrition, or maybe some activity differences that brings the monocyte activity lower. There could be diets with histamine that can go up and down in a person's daily routine. The stress levels of a person can increase epinephrine and not, and that can cause inflammatory state to fluctuate as well. And now if there is a baseline inflammation going on because of mast cells or macrophages or monocyte, then that would fluctuate as well. Then we saw a study where researchers saw abnormal blood cell structures. Some cells that are stiff had become mushy, some cells that need to be a little flexible had become stiff. And that was also, in their opinion, a cause of congestion and a cause of long COVID. Then here we're talking about Epstein-Barr virus or other viral. I'm sure that it is not just the Epstein-Barr virus reactivation. I'm sure there's going to be other viral reactivations as well. Then there is a very common thought that SARS-CoV-2 itself does not sit dormant and continue to persist. However, somebody sent me a research lately, which I've not yet gone over, where they said that this research shows that the SARS-CoV-2 hides in some tissues. I have to go see that yet to be able to say this is it. So that means there are so many possibilities of long COVID. Interestingly, most of the symptom set is the same because symptom set is mostly related to congestion and inflammation. Fortunately, compared to the myeloencephalitis and the chronic fatigue syndrome, CFS, it seems like this long COVID continues to reduce in its intensity even if you don't do anything. And secondly, we have good possibilities to cure it. And I think the research going in long COVID is going to help with the other chronic diseases as well. Calix Yukon says, Dr. Bean lectures, me and my friend had more side effects on first dose of vaccine compared to second. Does this indicate we may have had COVID? Possible that you had COVID, I'm just thinking aloud, that you had COVID before and your first dose kind of reacted to that. But then why not to the second one? So I think it is just immune system's behavior more than was it COVID or not. So DF and V says, looking at previous pandemics, it was usually 2 years for instance with SARS and H1N1. Do you think it will be the same with COVID-19? So we're almost in 1.5 years. So this may be 2 years. With the SARS-CoV-2, I think in a very, because we did such deep studies on this virus and the disease, sometimes I think that if the whole world just sat down in their homes and did not come out for a month, it would go away, because it cannot incubate in us and live in us more than a month. But that's not going to happen. If you put 7 billion people to say, next 1 month, nobody's getting out, a month later, there will be no pandemic. But not practical. The other possibility is you say to everyone, take ivermectin, and then it should also reduce in transmission. Another possibility is the whole planet gets vaccinated. Possibly that would help. So how long would it stay depends. How would it go? The SARS-CoV-1 did not spread that much. H1N1 had its own 2 years, correct. So it still looks like 2 years. Some countries might continue to have it for longer. Mark D says, okay, doc, man-made or natural? Come on, let us have it. So you're asking me as if I know. I have no idea. It is a very capable virus, but I have no idea how it came about. Hemi says, that was an excellent lecture. Question, would ivermectin work against EBV if we were making it as prophylaxis? So ivermectin works with the RDRP. Ivermectin works with the 3-chymotrypsin-like proteases. It works with other enzymes of ours as well. I am not sure if it works with the enzymes for a double-stranded DNA virus whose enzymes are working inside the nucleus. So I am not aware of that. I'll have to do some research, but that's a good question. Texas is a good question. Does the atypical delayed drug reaction to ampicillin, if given with mono, upset monocytes, causing them so more than the monocyte mast cells, but maybe monocytes get activated as well? I wouldn't think not. So Svetlana says, what is the mechanism of Hodgkin with EBV? So I touched on that today, that EBV can cause a B cell to convert into a blast cell, which sort of becomes immortal, plus just keeps avoiding apoptosis, and that can convert into these cancers. So I'm going to talk more about these tomorrow. Carlos has a good question. Since ivermectin is supposed to bind with spike protein, do you think ivermectin would be best avoided before getting Novavax? It is just a bunch of spikes. That's an interesting question. I didn't think about that before. So we know that in silico, in the computer simulations, ivermectin binds with the spike protein, part of the spike protein. So it is possible that that can be done with the Novavax-like vaccine too, but ivermectin doesn't cover it all. There is just 2 or 3 amino acids to which it binds. That means there is still going to be spike proteins where ivermectin will not bind. Plus, there would be some where it would bind, but they are still open for the epitope detection. So, and finally, when let's say there is spike protein and ivermectin bound to it, and that thing is going to be eaten up by macrophage. Remember, Novavax's main mechanism of action is going to be that macrophages or dendritic cells are going to eat up that little chunk and then break it up into smaller pieces. When they would break it up into smaller pieces, ivermectin would will be dismembered from them or separated from them, and then spike protein epitopes can be externalized. So I don't think it is necessary to not take ivermectin. Petra says, hi, is it possible that the vaccine is actually speeding up the process of making all the new variants that are popping up? No. This is a natural phenomena, and it would keep occurring with or without vaccines. Arun always has beautiful questions. So this question, prophylaxis for EBV. So I know that there are some prophylactic vaccines and such things. Let's discuss that as well tomorrow. That's a good question. Colin says, is the same time tomorrow? I missed the first 2 minutes of this half. Yes. Yes, same time, 6 p.m. Pacific time. So JohSentenza says, will you review the meta-analysis on ivermectin that has been recently published in the Cochrane Library? I will. My reason that I have not talked more about ivermectin is that I have about, I think about 30 or so talks about ivermectin, mechanism of actions, various studies, how it works. The analysis that are coming out now, these analyses have so many of, choose following studies to produce this result versus choose those studies to produce that result, that it has become a full-time job. And I'm seeing that folks like FLCCC or BIRD are doing a great job at focusing entirely on it. So if Cool Beans here would like to, I would love to review them. If it is just too much, then because there are so many other teams talking about it, then we can continue to talk for other things. Really totally up to Cool Beans. Brake says, blood transfusion upon infection with COVID-19, with that from a family member who is doubly vaccinated. Should this be at least partially efficacious? Apparently they use it in Spanish flu. Very simple. A vaccinated person would produce antibodies as well, let's say fully vaccinated, and that within the time frame of when the antibodies are being produced, the blood or plasma is similar to convalescent plasma. And so they would have antibodies that can be useful, just like convalescent plasma is useful. So it can be useful. It's just that the time of antibodies should be there. Danielle Bonk says, is ivermectin effective for long haulers? I just finished 5 days of ivermectin and no improvement. Long hauler 1 year. Should I try another round of ivermectin? Actually, if ivermectin does not work, try steroid with fluvoxamine. And again, I cannot give an advice to you. I will try steroids, fluvoxamine with my doctor's advice. If that doesn't, I'm sure it would work. But if that doesn't work, then macrophage activation syndrome or mast cell activation syndrome remedies, those should be tried. If that doesn't work as well, then the CCL5, CCR5 binding inhibitors, these should be tried. So there are more options to see what is the underlying pathology and to address that. And those are present on FLCCC. I had actually led that work, and we have that work over there. Sama says, Dr. Bean, here in India, Covishield, Indian AstraZeneca, showing around 90% efficacy after second dose administered after 12 weeks. That is good. Franz Lore, safely kiss the like button. Yes, without getting EBV from it. That was funny, Franz. Joanna says, a new internist tested D-dimer level. It was 3 times normal. His response is it's not worrisome because it depends upon the rest How about the CRP? How about the other things? Our D-dimers levels go up and down based on what we are doing, what is our body state, what medicines are we taking, did we have any other inflammatory conditions. So the ferritin level, CRP level, other blood markers, they all have to rise up together to say how good or bad it is. And a second opinion with the interns, seniors would be useful as well. Casey says, I'm wondering for killed virus vaccine like Sinopharm, whether monocytes also keep their S1 bits while eating up the remaining whole killed virus. Thanks. It is possible. Ideally, the role of eating up these pathogens or these antigens is for macrophages and dendritic cells. Monocytes are involved in repair, where they might end up eating broken up pieces or those macrophages that have eaten the pathogen and have S1 pieces. So can a monocyte end up with the S1? Yes, regardless of the infection or vaccine or type of vaccine. Yes. Petra says, thank you, Dr. Mobeen. You're very welcome. So MJ Carroll says, Dr. Marek just said today that Delta was more virulent. Do you agree? I usually agree with everything Dr. Marek says. Virulent. So there are two ways to look at that. The rapidity with which it would cause damage. And if let's say a person was protected by natural infection or vaccinated state, may not be sufficient to quickly step in for the immune system and become active and respond fast enough. Then you could say it is more virulent. But if you see virulence in normal, healthy individuals, and you compare alpha to delta, delta will be more contagious, more infectious, but so again, I'm thinking aloud as well when I'm thinking with you. But the virulence could only be if it enters the cell fast, it enters more cells, damages them fast, comes out, enters more cells and damages them fast. But we have done this discussion before. Any pathogen that becomes faster will have to reduce its lethality so that it can continue to go out to others. If it is more virulent, then its spread will reduce faster. The spread would reduce rapidly. So I don't see the spread reducing rapidly. So it may or may not be more virulent. To me, it seems like it is not more virulent. So Paul says, can Ivermectin potentially alleviate the symptoms of Lyme disease? Thank you. So Dr. Stephen Phillips, who has been here a couple of times, I think he's the leading chronic infectious disease doctor in the US. He has a book as well with the title Chronic. Please listen to his 2 talks. I connect with him and ask him that, hey, how's it going? And how about Lyme disease? And he says that ivermectin helps. So that is my knowledge about that. Or that is the extent of my knowledge. Jacob says, just got the first dose of Pfizer, but as a 28 years old male, I'm worried of the risk of myocarditis and other heart issues following the second dose. Should I skip the second dose? Depends how close your doctor is to these issues and how well they know how to manage it. usually they can give some anti-inflammatory and have you go through that second dose without any issues. So really just connect to your doctor and see how are they thinking. That would tell you a lot about what should be next. That's a good question. ZEYNSOLO says, does ivermectin tablet contain animal derivatives? I don't know. I don't know what you mean by that. I have to know more about your question. So Soma and Srijay says, do inactivated virus vaccines develop better immunity to the whole virus? Is adjuvant in Novavax a problem? So Novavax says that our adjuvant is actually very important. It is a chemoattractant and activates the immune system. There have been some articles I read about the Matrix M, their adjuvant, which say that there may be an issue. So I think we'll have to do some more research on that one. I don't think it is an issue. Now, the first one, in my opinion, inactivated virus. So opinion, inactivated virus vaccines should have worked better. However, so far, the data or the news that I see, and I say news because the countries that are using them are not providing data, at least I haven't seen that data, that we can use to make our own opinion. So most of the time, it is the news articles that are talking about them. So most of the articles that I'm seeing are saying, hey, they are less effective. I wonder why would they be less effective? So I just need to figure out some good data source for them. So DC Thomas says, Carvalho Ivermectin paper is fake. His LinkedIn looks fake. Journal is fake. Co-author doesn't list paper on CV. Who benefits from PSYOP? So I don't know if it is fake. He himself sent it to me as well. So I don't know exactly which paper are you talking about. And if you're talking about Hector Carvalho, at least the latest paper about the chronic long COVID or long COVID, he sent it to me as well. So I don't know exactly the background to your question. So coordinating for higher vibrational learning, good name. Dr. Bean, have you studied the TDP43 protein and its relation to its prion-like formation due to its interaction with the spike protein? No, I have not. That's an interesting one. Can you tweet the link to me so I can do a study? Petra says, send a love if you love Dr. Bean. Thank you very much. Love from me to all cool beans. So ZEYNSOLO says, my question relates to ingredients of ivermectin tablets. So ZEYNSOLO, that is the point. There are many ingredients. I have never researched those ingredients. So if you have some specific ingredient in mind, I'll have to research it. If you just say generally that, hey, are these animal derived, I'll have to go and research every single one of them. So I position me a little better other than just giving me homework to go do this research. If you're concerned about some ingredient, we can look it up. Lorraine says, have they actually isolated the virus? So again, if it is not a cynical question, then yes, we have not only seen the virus, we've seen the electron microscopy of the virus. I did a study, discussed it, where we actually saw the slices of the virus as well. So the world is not so backward that we cannot now, when we can do an electron microscopy of a single atom, you think we cannot get to a virus? We can. But if it is a genuine question, then yes, they have. If you're being just cynical, then I can't change mind. Philip Lewis says, thank you for the question answers. Would be curious which would be better for long term, natural immunity or vaccine immunity, if only one could be chosen. So I'll tell you my opinion. If I was given a choice that you can only have one, infection or the vaccine, I'll take vaccine because I am terrified of the infection. Infection does not tell which person will die of it or which will not. That doesn't mean that I'm not going to die one day. That doesn't mean vaccine might not cause a side effect. That doesn't mean something would just fall on me right now and I'll die. But as humans, we have to do our best to protect ourselves and the people around us as much as possible. After that, when it is out of our control, then it is out of our control. And I think that is the same thing as a doctor for our patients. If I cannot think about myself and care for myself, I cannot then think about others too. Although Andy Butler, she's a doctor, she has been helping me with the physiotherapy. And I have not been very active with the physiotherapy, so my hand problem is still there. So she might say that Mobeen is not as careful for himself as he is for others. But generally, we have to have that feeling of protecting ourselves and others. So natural immunity or vaccine-induced immunity, both should have long-term positive immune response in healthy individuals. I will not opt for natural immunity because that can kill as well. Felipe Gomez says, 30 years male, taken J&J 6 days ago. Since then, I'm having needle-like pain and short headache, vertigo and eye pain. Can this be normal? So please talk with your doctor. This could be something to do with clotting. The persistent headache after adenovirus-based vaccines could be a sign of clotting. So just talk with your doctor. They may need to do some, either they'll give you aspirins or something better, or they might even do some blood tests as well. Broque says, do you know the real numbers of deaths from the vax? No. Because so if I say VERSE is the real data point, then we know that VERSE doesn't have the right numbers either. So when VERSE does not have the right numbers, I don't think I have access to the right numbers. Lorraine says, I wasn't sarcastic. I was just wondering why they haven't done a vaccine with the dead virus. They have. It's just that in the Europe and US, majority of the vaccines are not inactivated virus vaccines, because I think, my opinion, because of the fear of incorrect inactivation, and virus causing vaccine containing virus that might cause problems. But there are inactivated virus vaccines from India and from China, and I'm sure other countries as well that I'm not aware of, but there are inactivated virus vaccines. And I believe Indian inactivated virus vaccine used the virus variant from Pune, and then they inactivated that. So Soma says, maximum to maximum, after how many days can blood clots occur? So look, understand the pathology of the blood clot. Blood clot is because of the antibodies against platelet factor 4, and the antibodies start getting produced any time from 4 or 5 days to 30 days. Mean time is 9 days. So that means from 5 days to 15 days and 9 days, 9th day are the most critical one. Beyond the 9th day, the chances reduce, but they do not finish. Jim Mattock says, the authors of Simplifying the COVID Puzzle claims you are much more likely to die if you have low vitamin K2 MK7. That's interesting. Why do they claim that? So Vitamin K2 is helping with the calcium deposition or mobilization in the tissues. Why would COVID? I know that whenever there is inflammation and there is damage to the tissue, calcium is deposited there, and K2 levels are necessary to keep the right amounts of calcium. I do not understand the mechanism, Jim. At least off the top of my head, I cannot connect the dots. I'll have to read it. Michael says, question, reports in Japan of persons close to vaccinated getting menstrual effects. It is unlikely shedding can do that, but it is there any basis? I would like to calm my friend's fears. Mouse studies. Not really. So this is either send me the study so I can see what they're trying to prove, but this is not some, look, having a person who is vaccinated or infected after convalescence shedding the virus itself or the spike protein, for vaccinated it is impossible. For an infected person it is possible for a given period of time, but would that just cause other person to have abnormal menstruation? It's not possible. If it is virus, that's going to cause COVID. Vaccinated person is not going to shed spike protein. Even if a vaccinated person shed spike protein, why is that spike protein not causing menstrual problem in them that it would cause the menstrual problem in somebody else? Martine Reed says, shouldn't government want some unvaccinated as a control? I don't think government is doing an experiment. This idea that this is a big experiment. Yes, it is an experiment because vaccines are experimental, but it's not a deliberate experiment on population. So JohSentenza says, do you think that the peer review system has been weaponized? Do you think that the unblinded RCT trials have been at this time with this COVID? You saw that all medical industry and research industry was weaponized, is weaponized, and I think it is going to stay weaponized. I cannot imagine this and I cannot believe this, that at the most critical time for humanity, when every single human being is concerned and worried about the same exact problem, and these folks are playing games. They could not choose another time to do this. For the pharma companies, this is their time to earn money. For the leadership, health leadership people, this is the time to pay back for influences, at least in my opinion. And then for doctors to just fight with each other, for researchers are coming up with the research that has been done before. They just have an opportunity to put their name again. It's just weird. Petra says, if there's clotting, will the pain always be there, or if it is possible someone doesn't feel it? Most of the time, there is persistent headache or persistent GIT symptoms or persistent shortness of breath, or repeated bleeding under the skin and so on. Most of the time, if clotting is occurring, these are persistent features, but could be non-persistent as well. Lemi Lemi says, Dr. Mobeen, would you kindly discuss the impact of nanotechnology in Novavax? What nanotechnology? I have done Novavax discussion a couple of times. Can you please watch those videos? I'm not aware of which nanotechnology. If you're talking about the Novavax's nanoparticle, then I've discussed that. But I don't believe there is anything else. So ditching the grind says, should we be taking vitamin D3 with K2? Vitamin D3, calcium, K2, and magnesium is a good package together to use. Colin says, did you see the weekly FSCC update? Seems a bunch of nurses are getting together to learn about then teach about ivermectin. This must be a good thing. Absolutely. No, I didn't watch it, but I'm sure it is a good thing. Absolutely. So Brake says, do you know how to get convalescent plasma? Well, in the US, at least the hospitals have those programs. So it depends upon where a person is. The hospital, you talk with their administration, and they may have that program. Thank you for the we, France. So whose super chat was that here? So DC Thomas. Simone Deans says, does the COVID vaccine weaken your natural immunity? Not at all. And it is such a disservice that was done by that person who said it, that it's embarrassing and it is shameful. No. ChiefsChiLLaXN says, can I get a doctor's note that exempts me from getting vaccinated? I have no idea. Can you? Really, the people who are or should be exempt, at least from a doctor's point of view. Otherwise, it is everybody's decision. They make a decision and they do what they want. Their communities, their employers, their families, their governments, but it's not my decision. A doctor, what is seen is that if somebody has severe allergic reactions, they should not take a vaccine, or somebody who is so sick that vaccine side effect might tip them over, just like that happened in Netherlands, they should not take a vaccine. Then we know that the vaccine, there are various kinds of vaccines should be given to various groups of people. Not every vaccine is good for every group of persons. Mind of Own says, thank you for being one of the most analytical and balanced voices on COVID issues on internet. Thank you very much. Simone says, Soma says, I think you're worried about the blood clots, huh? You have all the questions about the clots. About clots, can this occur after months? In some people, antibodies continue to go on for months, or they are produced a little later. But normally within 5 to 14 days, this should happen, if it is going to happen. But yeah, can it be after months? Depends if their immune system adaptive arm responds late. There have been people who responded late to SARS-CoV-2 even up to 28 days, but that should be really rare. Daniel says, Dr. Bean, hello from Santa Rosa, right up the road from you. Excellent. We should go to Starbucks and have coffee. Time Warp says, what is topical ivermectin? Topical ivermectin is a cream that is usually used for scabies or other skin conditions with worms. So it is applied on the surface, on the skin. Dishing the Grind says, thanks, Dr. Bean, for answering my question. Over 550 watching. Thank you very much. You're very welcome. Kathleen says, what about Amazon tests? Are they reliable? My patients want to try them. I think they are reliable. GK says, should I refrigerate ivermectin? Will it make it last longer? I think keeping it in a cool, normal temperature, less moist area and less sunny area would protect it more. That could be refrigeration as well, but not freezing. So Art Patron says, why only injection as a method for administration of vaccine? And Art Patron, you're correct. There are nasal vaccines now, there are GIT vaccines, there are subcutaneous vaccines. So those are made, I think they're not getting traction. That also is, once again, small company versus big company. There are smaller companies that have nasal sprays and oral sprays. They're just not making progress. ZEYNSOLO says, so there is no scientific explanation why the unvaxxed have menstrual disorders when being near vaxxed people. So Zan, show me a study that I can read and talk about. I don't think that there is a mechanism that would do this. So Texas says, paw the like button with gloves. Sinex France locked it. 134 out of 57. Yes. So this glove. Genesis Light says, can the ferritin be the marker indicator for the prognosis of COVID? Genesis, ferritin alone is not sufficient. I did a talk. It was done by a research unit in a university here in the US, I think about 6 months ago, where they had took some 10, 20 labs and created groups of the labs. And for those groups, they had threshold levels. And they had said, if this group of lab has following thresholds, then you have a chance that this person would become severe. So I think that was a fascinating work. It just did not get traction, but there is a study that I discussed. Emilio says, is it true that virus mutates and adapt? Yes, it tries to mutate to adapt better to us, which has been taken in a different way as well, to say it is trying to adapt to keep being our enemy. A virus cannot continue to be our enemy like this. I mean, look, we have HIV, but eventually we're trying to figure out how to work with this. Coronavirus is very different from HIV from the point of view of the type of damage it causes. So it's not going to adapt enough to be our enemy forever. It will have to adapt to become our friend. Rose says, sorry, the question scrolled away. Rose says, do you have thoughts on hydroxyzine pamoate? No, I have not read. Soma says, thank you, you're great, thank you very much. Chief Chilla, your name is fun. If the vaccine goes to the ovaries, does that affect the fetus ovaries, because women are born with all their eggs for their entire life? So I think the first question should be, do the vaccines go to the ovaries? Then the second is, if they go to ovaries, I would put the question this way: wherever there is vaccine, there is going to be inflammation. If there is inflammation, there is going to be some cell damage. So then the question will become, if we cause inflammation in the ovaries, will that cause damage to some cells? Yes. Jen says, prophylaxis with Ivermectin, air travel, best way to use. I have asked all of my friends, families, to start using ivermectin before, during, and after for a few days. Brake says, do you think all the reports of headache from vaccine are... No, that's not true. Headache is a very common vaccine side effect, but it's not necessary that all headaches are clotting. France says, the WHO is the one dislike. Possibly, yes. They, as you said, they gently kissed the down button. CBD maker says, my son is 22 and overweight. He's going to get Moderna. Will taking low dose aspirin help him to not get any clotting? That I cannot say. I've been very, very clear. I cannot give a specific message. The best is to talk with the doctor. Of course, clotting is reduced, prevented in some cases by the anti-clottings like aspirin, but aspirin may not be sufficient in some cases. So this is why it is important to sit down with the doctor and say, what is the right thing to do? John says, question, me again, 34, healthy. After hearing that you'll choose the vax over national protection, I'll likely get the vax soon. Excellent. And stay safe, happy, healthy. This is how I would do. And I have proved it. I have taken my vaccine. My sons, 27 and 23, have taken vaccines as well. My wife has taken vaccine as well. So at least my money is where my mouth is. So Red Poor Jack says, Dr. Bean, have you any opinion on the veracity of the federal lawsuit regarding 45K US COVID vaccine deaths? I have not. It will be interesting. Can you tweet that at me? It would be great to read it. Evan says, which vaccine? I took Moderna. And again, it was not my choice. I went there and they said Moderna. And I said, okay, fine. So Chelsea says, I have long wax issues. Would ivermectin help? Mostly respiratory symptoms, shortness, breath, chest, and pressure, imaging, labs all normal, my antibody level. So yes, and also look at the long haul protocol on FLCCC's site that has multiple more options as well. So DC Thomas says, co-author Saltis doesn't list paper on his university list of publications through Google Scholar links him, though Google Scholar links him. Pharma PSYOP to discredit, possible. There is a lot of possible. There's a lot of this unethical, unprofessional, almost criminal things continue to happen. Hope says, what kind of virus mutates to become our friend? All viruses adapt. Do you know that when we make viruses-based vaccines, inactivated virus vaccines or partially weakened viruses, do you know how we make weakened viruses vaccines for us or for others? Let's say we want to make a human vaccine, a vaccine for human, for a virus that infects a human, and we want to make it weakened. What we do is we take that virus and put it in chicken cells, for example. It doesn't know how to infect chicken cells because it knows how to infect a human cell. But there may be one or two that would accidentally enter a chicken cell or would have some mutation on them that would help them enter a chicken cell. Then what they do is they open up the chicken cell and take that virus out that was successful in entering that cell. They'll put that again in another bunch of chicken cells. And now these viruses might have mutated further, and they would find it easier compared to last one to enter the chicken cell. And they would keep doing it for 100 and 150 times till the time that the virus becomes mutated enough to become friendly with the chicken cell and enter that cell. Now in that process, that virus has forgotten how to enter our cells. And from our point of view, now it is weaker because it cannot enter our cells that easily. Then they do further treatments to make it more weak, and now it can become a sample virus to make vaccines. So viruses adapt. Some don't. We have hepatitis viruses which don't adapt, and they just sit there and cause damage. HIV sits there and cause damage. EBV, we talked about it. So there are some that don't. Coronaviruses live with us, cause some mild infections and go away. SARS-CoV-2 is adapting as well. So this will be a difficult situation for the SARS-CoV-2 to become more contagious and more virulent or more lethal. It will have to adapt, or it will have to be eliminated. Anubhav Das, after a long time, are non-sterilizing vaccines really a concern? Like, do they have the potential to give rise to variants, or is it just another theory to spread panic? No, so there is no issue. This idea that somehow, tell me this, neutralizing antibodies for respiratory viruses, neutralizing vaccine will mean a vaccine that is able to protect the mouth and nose and eyes, or something that can attach to the epithelium like SARS-CoV-2, protect these areas at all time. And how would that protection come about? By continuous presence of IgA and continuous presence of active immune cells against the pathogen. Do you think it is possible? Our immune system's behavior is that once it starts making antibodies, it reduces making antibodies after a few months. It is a natural behavior so that immune system is not always making antibodies. Imagine if our immune system, B cells, were making antibodies from the day we were born and infected by various pathogens till today. Our blood would be thick milkshake of antibodies. And that doesn't happen because our immune system is wise enough to say, I took care of the virus and then I provided some extra cover for some months and now I'm done. I should stop now, otherwise I'll make this person's blood thick with the proteins. So is it really possible to create a neutralizing antibody or vaccine that would stay here and make IgA forever and make immune cells here forever? That's actually not possible with the SARS-CoV-2-like pathogens. So those folks who are saying that we should make neutralizing antibodies, I know who are saying, and they have their own theories to make their own neutralizing antibodies. And I think for them, it is important to first badmouth other antibodies to then say, I can make this. And they actually, if they can make it, they should just go and make it. Make it, do a test on animals or in vitro cells and come back and say, I made this and this vaccine, it does this, and I can prove it and see the results, and then go and be influential. So they have nothing in their pocket to show, but they just continue to badmouth and create rumors for other things. Mark O'Kane says, how did the idea that PCR tests are picking up fluke, not COVID? I heard Alex Jones pushing that line the other day, but it makes no sense. Trying to explain something with Alex Jones is a difficult thing. So apologies, I can't explain him. Philip Lewis says, Why do some people get this virus, don't show symptoms at all? What makes their immune system different? Philip, this is a very good question. And there is still no answer for why some people become severe and some people just have asymptomatic infection. The researches that have been done so far, the researches that have been done so far, they say that, for example, in the children, the innate arm is better prepared than the adaptive arm. And that means, number one, their ACE2 is less dense in their respiratory system. Number two, their natural killer cells are more, sorry, there is Luffy here playing with, and he has a new bell. So apologies. So natural killer cells are more active and more in number in the children who are asymptomatic. Plus, children are asymptomatic and they have more cross training from respiratory epithelial or respiratory viruses. I would suspect a similar thing that happens with the adults as well. In addition to, there is also research that says those individuals whose immune system respond primarily through dominant Th1 pathway, that means cytotoxic pathway, they have less symptoms. So these are the studies, but exactly who would respond which way is not known. Cybernurse, thank you very much for the super chat. Mike says Luffy is probably hungry. I think he wants to go out. Luffy is pressing the like button. Absolutely. So Texas is saying that, hey, Luffy is ringing, paw the like button. Absolutely. Paw the like button. Someone else says, Dr. Bean, your thoughts on study. Human rhinovirus infection blocks severe acute respiratory SARS syndrome replication within the respiratory epithelium. I have not seen this study itself, but that is exactly what I was talking about. Not exactly, but that is the kind of thing I was talking about, that we say that in children who have become exposed to other respiratory infections have a better immune system that can help against the SARS-CoV-2. So maybe this is one mechanism. Luffy is here with the bells on. He just actually went that way and opened the door by himself. Luffy is quite independent. Our patron says some people do have natural immunity. Yes. Ditching the grind says, when exactly did your huge following start? Uh, I am grateful for all the cool beans that are here. And I think it's 15 months we've been talking about various mechanisms. So I'm grateful for this. I'm not sure exactly. I think the following fluctuates. Sometimes I say things that some folks don't like and then they go away. And then sometimes I say things which folks like and they share and folks come in. But I believe in what Seth Godin says, that as a creator, you should create, you should make, you should present something that you think is of interest. And then let people decide if they like it, they would come about and be with you. And if they don't like it, they won't be with you. So I'm grateful for everyone who's here. So just trying to see if there are more questions. Genesis Light says, would you space the Pfizer Moderna to 12 weeks to stretch the efficacy? Actually, I really like UK's way of separating them out. But the Delta's rapidity of infection and reduction in first doses efficacy makes me nervous. However, UK did something that made me nervous as well when they said, we're going to increase the time between the two doses, and they succeeded. So it may be an interesting idea to have one dose and continue that on for a longer period of time. The only thing is, please realize, vaccine efficacy after one dose nowadays against Delta has reduced. And there are mixed, UK has a different number and Israel has a different number and others have a different number. Some newer cool beans sent me a lot of messages that you compared UK and Israel. Don't you know that UK has a longer period and Israel has lesser? So there are different numbers, and I think that efficacy is impacted. So John Melissa says, Dr. Robert Malone said that there is some evidence that the Pfizer vaccine is showing signs of antibody-dependent enhancement in the waning stages. Is this a valid concern? No, this is a BS concern. There is no such evidence. There is no such study. And there is no such observation so far. F. Seni Viva says, is there any to know if we will have long-term side effects from taking mRNA vaccines? That's a very good question, and I have no idea. Just like we do not know who will get severe, similarly, we do not know who would respond differently to vaccine. That's a very good question, but don't know. Lemi Lemi says, what's your opinion on Professor Bhakti's assessment? I haven't actually looked at his messages. Somebody reached out to me that I was talking about endothelial cells cannot express spike protein. I saw some people really reacting violently in the comments. So that made me suspicious that there is someone who has talked about it. And someone said that Bhakti would have talked about it. I don't know if he has. If he has, then he's wrong. And if he has not, then I am sorry I called him wrong. Daniel says, I've been a lurking bean for a while, but now I'm a participating bean. Welcome. You have upgraded your bean status. Texas says, yes, BS. He said, yeah, so it is BS. On top of this, when folks propagate this kind of bullshit, then it becomes an issue to go and handle it and explain that why it is not possible. A few days ago, we were talking about this endothelial cell issue, and somebody became very upset, and they said to me that this is not possible and this is how this happens. I usually do not respond a lot because it becomes very difficult to then explain every step and provide references, because if I explain a step, then they say, okay, prove it. So now if I provide a reference, then they'll come back with something else, and now this. And it becomes just my duty to continue to provide references and links, and I just don't have that much time. So this person challenged me. I provided information. They said, okay, I understand what you're saying. I stand corrected. Then they had another set of incorrect assumptions next. And now once again, it became my problem to correct them. So I just left it. Redpoor Jack says, question, this isn't a question. Okay, I just put the question to catch your eye. I have seen the tweet with the link to the case filing of 45K. I've sent the tweet. Okay, thank you very much. I'll look into it. So Arun, can SARS-CoV-2 stimulate EBV and show symptoms of EBV? So that study that I would discuss on Monday did say that. They said that SARS-CoV-2's presence ended up reactivating EBV, which then showed EBV symptoms, which people thought were COVID long haul symptoms. So you are already on the spot. That's a good question, Teresa. How about clinical trials of the antiviral nasal spray from Israel? That's a very good question. I think I should reach out and ask them. I do not have an update, but I remember UK and Israel had actually asked them, I believe, to use it. TP says, how about ivermectin in between doses? Yes. ChiefsChiLLaXN says, does being on ketosis affect COVID in any way? I heard ketosis helps with antiviral mushroom therapy from Paul Stamets. No idea, but it should not. It doesn't matter how our body's state is. Ketosis can cause slight acidity, which then our body learns how to work with it. So it depends which state of ketosis you are in. But normally our body would have adapted and learned and will be working with it. Nettles Cats says, I'm still here. I just watch on the TV, always liking. Thank you very much. So Jeev George says, what is the purpose of ACE2 receptor? Are these drugs to limit the development of ACE2? So the ACE2 are very important receptors in our endothelial system, especially blood vessels, to create an anti-inflammatory response to pro-inflammatory signals generated because of ACE1 stimulation. And renin-angiotensin system, which produces ACE1 and then as a result not ACE1, angiotensinogen and then angiotensin 1 and then angiotensin 1 to 7, that system is very important to keep the blood pressure maintained. So ACE2 are very important for helping with the inflammatory state, for countering the inflammatory state that is generated when we are trying to maintain our blood pressure. Now, the second part of your question, are there drugs that limit development of ACE2? There are ACE inhibitors. They are normally for ACE1 type receptors, but I'm sure that these drugs can be made. I don't think we want to block ACE2 so that virus cannot attach with them. ACE2 have an important anti-inflammatory function. Keter Malkot says, is Dr. Bean promoting vaccines because he's afraid YouTube will demonetize him or remove his account? He loses a great income. I already have been demonetized. My 54 videos that include ivermectin discussions, that include discussions for COVID management other than with vaccines. I had one more channel that has been fully demonetized, and not only that, all videos removed. So it is a small thinking on folks' end who think I talk about vaccines to save my income. If I was saving my income, I would not do these talks and just pay attention to my business that I have not paid much attention in 15 months because I do these talks. And I used to make much more money there. So I can't stop people from making stupid comments, but I have always been talking about vaccines, and I'll continue to talk about vaccines. When there is a side effect of the vaccine, I talk about that as well. I was the first one who started making noise about the clotting, to the point that people sent me threats. And I'm also the one who talk about vaccines and their efficacy, to the point that people send me threats and these kind of stupid comments. Jan Maslate says, Dr. Bean is ridiculously wealthy due to cashing in on Luffy's good looks. Absolutely. I sell Luffy's pictures. So Augie says, do we know how many people have successfully completed FLCCC? I'm hoping you're talking about the long haul. I don't know, but I have a lot of people giving feedback that it has been very, very helpful. I think Lemi's job today is to ask me about all of such folks. Have you heard of Dr. Mike Yeadon's claim? No. And I'll have to hear if there is something interesting there. And just to this commenter's comment, my videos that used to be the most earning videos have already been demonetized. These were ivermectin videos. These were mechanism of actions of hydroxy, ivermectin, zinc, and so on. They are already demonetized. They are already, some of them, taken down. So if you, this has to be a real small thinking to put money in there and say a few $100 should sway me one way or the other. It may sway some people one way or the other. Jody says, why would nasal wax potentially increase T cells? That's a very good question. So there is one thing that we know, and that is that those vaccines or infections that are of the epithelial surfaces usually give rise to more epithelial defending immune responses. For example, more production of IgAs and so on. There are some vaccines that have some adjuvants in them that can preferably move the immune response, naive T cell, from going towards Th2 to Th1. So does this nasal vaccine has that? I do not know. But if it is moving it towards more a Th1, then there can be two answers to that. One is they just luckily have some substances in there that allows more Th1 conversion, or they have deliberately added some adjuvants or some chemical substances. For example, we know a naive T cell moves towards Th1 when we have interleukin 12 present. So there may be some chemical treatment in there. I'm not sure about that. Soma says your research will help all over the globe. Thank you. You're very welcome. Mir says, silly question. Do people create more ACE2 in the presence of increased inflammation? So would people with chronic inflammation issues have more ACE2 receptors and a worse response to COVID? I mean, that is a very interesting question. So if we think about it, yes, if somebody has a higher inflammatory state, that will mean to counter that, they may have more ACE2 receptors, which act as an anti-inflammatory signaling. However, I believe, and this is my belief, ACE2 are not directly related to anti-inflammatory state or management of it like immune system cells are. ACE2 are more related to responding to the chemical substance that binds with them, which is a byproduct of angiotensin 1 or angiotensin 2. So I think they are regulated based on the concentration needed to work with the product or ligand that works with them. Very good question. Eric says, heard of anyone getting their full smell back after 8+ months? Yes. And what I have seen so far in my patients, even after a year, high dose ivermectin, and for me, the high dose is 0.2 to 0.4 milligram per kilogram body weight. That helps a lot. Within 2-3 days, the sense of smell starts returning. Someone else says, thoughts on Dr. J. Bart's Klassen's Jan 2021 paper, COVID-19 RNA-based vaccine and the risk of prion disease. I'll have to read that. Lemi says, I have a dog, but I will buy a Luffy, and I love Dr. Mobeen t-shirts. Thank you very much. Trillium says, did you go over Odyssey as well? Yes, I did. So all of my videos are now on Odyssey. Let me show you. Which, again, for our commenter, which made me a little upset, Odyssey doesn't give me anything. If I go to Odyssey and I go to the channels, here is Dr. Bean channel. This is all of my videos. If you see here, I think it tells you, I don't know if it tells you here, 1076 uploads. Every single video that you see here is there. So, and I don't know how, I don't even know what it means, but you can see here, this is my, whatever these are called, libris, 2338, whatever that means. So I'm not looking for money. Someone else says, love you, Dr. Bean. Thank you for talking about these things. You're very welcome. Today it's almost 8:18. Ray says, my wife has discovered a new long haul symptom. She no longer enjoys shopping. That is a good symptom. Tokoloshi98 says, am I wrong in believing that the existing data on ivermectin is not substantial enough to call it a definitively successful treatment? Isn't the sample size across all randomized studies about 2K? Tokolosh, I have a very simple answer which works for me. It may not work for you and for others, and that is this. I have been managing patients with ivermectin, and because of that, I've been seeing results. Because of that, my own observation, my own doctoring has shown me very good results. So I don't even care at this time. Where are the studies? What is the data? Hydroxy worked very well. Zinc worked very well. Quercetin worked very well. Ivermectin worked very well. Works very well. Vaccines have their own very good efficacy as well. So to me, that is what matters. I have less. I don't keep an eye on the. If you look at my videos as well, there were videos about a year ago when I looked at various ivermectin studies. I did a video, I think in last March, April, where the title of the video was Ivermectin Works. And in there I had presented some studies to cool beans who are here, I think 6 or 7 studies, and the p-values and the significance and the data there. That was a study that was picked up by, that was a video that was watched by Dr. Paul Marik. From there, his interest appeared, and then the whole FLCCC thing started. I have recently been talking about the mechanisms and everything. So the only thing I didn't do further is that talking daily on the meta-analysis, or they removed one study there, or WHO is doing something. It is useless for me to get into these are petty things they're doing. WHOs and CDCs and FDAs. Just like I said, there's a small thinking. This is a small thinking on their end. They are still money oriented. So I don't think everybody has this advantage that I have, and that is to actually see the results for my own patients. Now, you could claim this. You could say, all of Dr. Mobeen's experience itself is a placebo effect on his patients. And that may be true. Because ivermectin doesn't have 100% efficacy. And the virus itself doesn't have 100% death rate, luckily, right? So it has a very small death rate. So the way to look at it, and I discussed this about a year ago, that to look at the success of something in the one are the controlled trials studies, and the other possibilities are to look at how the, for example, out of 100 people who become COVID infected, 19 people end up in hospital, 3 to 5 die. So if a person who has 100 COVID patients come to them, and then none of them die, and they repeat it and the same thing, and they repeat it and the same thing, then they may have something they found, and it may be interesting. So even if others don't want to use it, for that person it is very near and dear because it is helping their patients. That's one part of the answer. Second part of the answer is, and again, your question may be very, very honestly curious to say, give me some more data to prove to my friends, to myself, it is important. But look at bamlanivimab, for example. FDA approved it based on 400 people's or 470 people's trial. And the trial was phase 2 trial, in which 300 people, 100 group each, were actually just the dose difference groups. And they approved it. They never said that it is basically a 200 people's comparison. Similarly, there are new things that they're approving nowadays with the smaller number as well. So I think number game is kept for when they want to discredit something. Otherwise, they can approve something with 470 people in a phase 2 trial as well. Snow Shimmer says, my father, 81, just released from ER and diagnosed with COVID, oxygen stable, gave steroids, monoclonal antibodies, have him home 2 days for COVID, lungs clear. Should we still get Ivermectin? So number one, congratulations. I think that he has actually made it. And because he has, you give Ivermectin or not, it shouldn't matter. Give Ivermectin just to avoid the possibility of long hauling, but that is with his doctor's advice. So Prince says, Dr. Bean, a US chiropractor claims to have quick fix to restore taste and smell post-COVID, swears by it by placing finger over olfactory bulb. So olfactory bulb is in here. Does he put finger here? If he does, then that is of no use. And if he inserts the finger in the mouth or from the pharyngeal area, that would be weird. And tapping back of the head. So olfactory system has nothing to do with this. I don't know what is the mechanism. I'll have to look at the mechanism to see. It doesn't make sense to me. So someone else, if you wanted to send me some studies, just tweet them at me, Drbeen_medical. Petra says, thank you, very welcome. Is it really small thinking or perhaps a desire? Possibly desired intent. I just find it difficult to think that people are deliberately doing wrong. Okay, cool. So I think this is where we are for today. And let's stop here. If you would like this work, please do me a favor. If you want to support this work, if you like it, you can support it with PayPal. You can support it with Buy Me a Coffee or being a patron. Thank you very much. And we'll continue with our EBV discussion. Tomorrow, we'll do serology. And thank you. See you tomorrow. Bye-bye.